how many is everybody can reverse diabetes, or there's a typical situation that is more amenable for diabetes reversal? What has been your experience on that one?
So from what I have seen is that the lower the A1C, the greater the chance of reversal. Also because you've had it for a lesser amount of time, you have more what we call beta cells in your pancreas that secrete insulin that help you to function better. The longer you have diabetes, the more insulin resistance you are, the more obesity you have. It takes a longer time. It's not impossible, but it would be involving a lot of dietary and lifestyle change measures. And if people are willing to go about it, then yes, it will happen. I had a patient who actually is now a health hero here, but he came in with an A1C of 10.5 or 11 and is now down to, I think, less than 5. The man was, I started him on medications and insulin and everything. And I told him that if you change a lot of your lifestyle, and I kind of guided him into it. And I think he just took over and changed everything. The man lost more than 30 pounds, 30 to 40 pounds maybe, and completely reversed everything. So yes, it is possible, but one would have to make a lot of changes.
Got you. So basically, earlier the better, and more you
That's why pre-diabetes has come in the picture. It's so that people catch things at an early stage.
Got it. And Amit, what has been your experience? You guys are pushing the bar with respect to diabetes reversal. What has been your experience in that front?
Yeah, I mean, this is an area that I could probably spend too much time on, but I won't. But we actually are. Some of our research papers are the ones that coined the term of diabetes reversal. We purposely chose not remission and reversal instead, and so we believe that it is a broad solution. I agree with Dr. Bindra. It takes a good amount of change, but that is what we're all about. And so we believe that it's we've had patients that start across the spectrum of A1Cs. We do C-peptide test to Dr. Bindra's. C-peptide is a test that looks for beta cell function, as Dr. Bindra mentioned. And so we do those tests to make sure that patients are able to reverse. But we have found our clinical trial results indicate success in about 65% of the patients we worked with, and even the 35% of the patients that did not reverse saw an average A1C reduction of about 1.5 points. And so, even if you're not completely reversing the disease, you're still able to get a lot better. Again, I quoted our average weight loss in that trial was about 12%, et cetera. And so it's a pretty, I think if people are interested in it, it's something that, as Dr. Bindra said, takes commitment, but is totally doable and is doable for a broad spectrum of the population. So, happy to talk about it, but I think it's a great solution. I've done it. I've reversed my pre-diabetes and I love it. So
yeah, perfect. Congratulations, Amit.